Good morning, everyone.
Good morning, sir.
Morning, sir.
Okay.
Morning, sir.
Okay. Today our topic is small intestine. I guess last time we had a topic on stomach taken by Dr. Ofisha, I guess. So today we'll do the small intestine. All right. Can you see the diagram?
Yes,
Yes,
sir.
sir.
All right. Very good.
Yes, sir.
So we have a stomach here. Then we have this is lesser curvature, greater curvature of the stomach. You have pylorus around this area. Then from here you have the duodenum. Okay, from the duodenum, then you'll have a jejunum, and towards the end of the small intestine we'll have a ileum. So when we say small intestine, it starts from pylorus, from here, the yellow marked area, from pylorus to the ileocecal junction, which is a junction of ileum and cecum. This is a cecum. This is a part of a large intestine. So when this small intestine comes and meet here, this part is called ileocecal junction. So the definition of small intestine is, or the extent of the small intestine is from pylorus to the ileocecal junction. Now, when we talk of small intestine, it is 6 meter in length. Okay, it is 6 meter in length, and it has three parts. It has a duodenum part, jejunum part, and ileum part. See, the first part, this sheath-shaped structure here, this is the duodenum. All right, and from duodenum we'll have the jejunum, and from jejunum to ileum, the demarcation is not very clear, but then there are some characteristics which I'll show you in towards the end of the slide, towards the end of the lecture, that you can make a difference. But if you look from outside, you cannot just make out. You cannot make out whether this is jejunum or whether this is ileum. Anyway, now that you know that ileum is towards the end of the small intestine and is joining with the large intestine, the cecum part of the large intestine. So we know that towards the end we have the ileum, and between the ileum and duodenum we'll have the jejunum. All right. So jejunum is 6 meter in length. I said there are three parts: duodenum, jejunum, and ileum. Now we'll in this small intestine, I think duodenum part is very important in terms of, I guess, in terms of exam or in terms of knowledge also. And jejunum and ileum, not so important, I guess. Okay, so we'll try to cover the duodenum in detail. All right, duodenum, as we saw in the photo, see here, duodenum is the first part of the small intestine. Okay, it's the widest and the shortest part of the small intestine. See, duodenum is the first part, shortest, widest, and the most fixed part of the small intestine. So that means the other part of the small intestine, which is jejunum and ileum, are highly mobile. They are not fixed, but duodenum is the widest and the most fixed part of the small intestine. Now we have seen the extension of small intestine from pylorus to the ileocecal junction. We are talking in specific about the duodenum. So duodenum extends from pylorus. Okay, it'll extend from pylorus and then it will end at the duodenojejunal flexure. I'll show you where is that. Okay, duodenojejunal flexure. Around this area will be. This picture also not so clear. Anyway, this is the pylorus. Here is the duodenojejunal junction. This part is called the duodenum. It's called duodenojejunal flexure because it has a band over here. It has a band, okay, and this band is at the junction of duodenum and jejunum. So that's why it's called duodenojejunal junction. So duodenum extends from pylorus to the duodenojejunal junction. Duodenum itself is 25 centimeter in length or 10 inches. Okay, 25 centimeter or 10 inches. Now it begins at pylorus. It begins at, now this is the location. Okay, this is the location of the duodenum. It begins at pylorus, and where does it lie? It lies on the transpyloric plane. Transpyloric plane. Anyway, do you know what is transpyloric plane? When you did the abdomen, you divide the abdomen into some quadrants. Okay. Okay, let me go to the transpyloric plane first. So when you see this picture, can you see the picture, everybody?
Yes, sir.
Yeah. So I'm trying to
Yes, sir.
show you the transpyloric plane. Okay. You take a two vertical line. This is two vertical line. This is at a mid clavicular line, and you take a line just below, just around this area, and one is at the superior iliac spine. You take these vertical lines and the horizontal lines. The first horizontal line is known as the transpyloric plane. Now we are trying to describe this duodenum. Where does it lie? It lies on the transpyloric plane, 2.5 centimeter to the right of the median plane. 2.5 centimeter, median plane will be here in the middle, that goes through the sternum. 2.5 centimeter right to the median plane. And where does it end? It ends just below the transpyloric plane. It ends, this is the beginning, 2.5 centimeter median to the 2.5 centimeter to the right of the median plane, and it ends at the lower level of the transpyloric plane on the left side of the median plane. If the median plane, if you draw a line in between through the sternum, if you draw a line, so on the beginning is on the right side, and the ending of the duodenum is on the left side and below the transpyloric plane. Okay, it begins at pylorus, lies on the transpyloric plane, 2.5 centimeter to the right of the median plane, and it ends at a duodenal-jejunal junction, 2.5 centimeter to the left of the median plane. Okay, little below the transpyloric plane. So this is the location of the duodenum. And this whole thing, you can just see this whole thing, this 1, 2, 3, 4 lines are dividing the abdomen into 9 quadrants. Okay, and duodenum lies at which level? When we talk about the level of the duodenum, they lie at the level of L1, L2, L3. L1 is nothing but the lumbar 1, lumbar 2, lumbar 3 vertebrae. Okay, see the shape of the duodenum. As we can see, is a C-shaped structure. It's a C-shaped structure, and on the concavity of the duodenum, inside the concave of the duodenum, we have the head of the pancreas. Head of the pancreas meets here, and you have the main pancreatic duct opens into the duodenum around this area. And we also have this part is known as the major duodenal papilla. And there is an accessory, you can see here, this is an accessory duct, pancreatic duct. It also opens into the duodenum, but this accessory pancreatic duct may or may not be present, not present in all the people. So this is called accessory pancreatic duct. It also opens into the inner concavity of the duodenum. So, and you can also see this is a gallbladder. You have a gallbladder. Okay, you have a cystic duct, you have a common bile duct, and this one is a hepatic duct. It comes from the liver. Here above here will be the liver. From the liver you will have 2 hepatic ducts. From the gallbladder you have a cystic duct. The 2 hepatic ducts join to form the common bile duct, and the common bile duct plus the cystic duct joins to form the this common hepatic duct plus the cystic duct forms the bile duct, and this bile duct again will open just before the opening, will open with the main pancreatic duct, and this whole thing is known as the hepatopancreatic duct here. Okay, as I said, this is located in the abdominal cavity. I mean, the duodenum is located in the abdominal cavity at the level of L1, L2, and L3. See now, duodenum itself again is divided into 4 parts. The first part, which is also known as the superior part, the second part, the vertical part, third, the horizontal part, and the fourth part. Okay, you can see the first part is between the first part of the duodenum and the second part of the duodenum, you have a flexure band over here. This is known as a superior duodenal flexure. And again, similarly, towards between the second and the third part, you have another flexure, which is known as the inferior duodenal flexure. The first part is the length of the first part is 5 centimeter. Second part 7.5 centimeter. Third part is the longest, which is 10 centimeter, and which is in front of the L3 vertebrae. Okay, and the fourth part is a slightly going up part. This area This part is the fourth part. So after this fourth part, you'll have the jejunum. So duodenojejunal junction is around this area. So at the beginning we said duodenum begins at the pylorus, which is around this area, and ends at the duodenojejunal junction, which is at this area. Now the main function, as we just saw in the previous photos, that so many ducts are opening here, right? The pancreatic duct, the bile duct, they all will open here. So all this pancreatic duct and the bile ducts, they give the bile and the pancreatic juice, the pancreatic enzymes. Those help in the digestion. So the main function of duodenum is to digest. Whatever comes in is to digest. It receives, so before the first part of the duodenum, you have a stomach here. So it receives the chyme. It's a mix of the food which has been mixed in the stomach. The chyme, it receives the chyme from the stomach, which is mixed with bile and pancreatic juice, pancreatic enzymes over in the duodenum. So the main function of the duodenum is digestion. Now let's see the interior of the duodenum. How does it look like and what are the characters? When we see the interior of the duodenum, you will see that the mucous membrane presents many circular folds, and those folds are called valves of Kalkrings. But in the first part of the circular, the first part of the duodenum, it does not have the circular folds. Okay, we'll see in the photo. See here, this is the first part of the duodenum, and the rest, second, third, and fourth. You can see the second, third, and fourth. There are many foldings. These are the foldings. Okay, these are the foldings, and these foldings are called the valves of Kalkrings. But in the first part, you see that foldings are not there. So the first part of the duodenum is devoid of those muscular folds. And what else can you see here? You can see, first of all, you can see the foldings. Okay, the first part is smooth, and you can also see, if you can see here the big one here. Can you see my cursor?
Yes.
All right. Can you see this major duodenal papilla of Vater? This is the major duodenal papilla. Okay, this is where the pancreatic duct opens into. This pancreatic duct, the main pancreatic duct will come and open into this major duodenal papilla, or this is also known as papilla of Vater. And just above that, you'll have a hood-like structure. Okay, these are again foldings. It has a hood-like structure. Again, the fold of the mucous membrane is known as the monk's hood. Okay, semilunar fold of the mucous membrane. Then just right above that, again you see the minor duodenal papilla, where the accessory pancreatic duct opens into. All right, this is where the accessory pancreatic duct opens. Again, come back to this major duodenal papilla or the papilla of Vater. You can see some extension, longitudinal extension. Okay. Okay. Now see, let's go through some of the special features of the duodenum interior, the interior part. Some features which I have just mentioned. I'll just go through the text. Major duodenal papilla. These are the well-marked conical projection on the posteromedial wall, and is situated 8 to 10 cm distal to the pylorus, where the common hepatopancreatic duct opens. So this is the major duodenal papilla. This is where the common pancreato-hepatic duct opens. The pancreatic duct and the main pancreatic duct and the bile duct, they open here. Okay, next one is minor duodenal papilla. Again, this is a small conical projection situated 2 cm proximal to the major duodenal papilla. Major duodenal papilla, proximal to that you have this minor duodenal papilla. And again, as I said, this will give opening to the pancreatic duct. Now again, you can see this one more, this above this, arc of the plica semilunaris. It's nothing again but the arc or fold of the mucosa above the major duodenal papilla. Then last one is the longitudinal fold or plica longitudinalis. This is the vertical curvy or vertical tortuous fold of mucous membrane extending downward from the major duodenal papilla. So these are the characters of the duodenum anterior. So I'll repeat again. You'll have two openings at least, or at least one opening, or maybe two openings. One opening is the opening for the pancreatic duct, where the bile duct and the pancreatic duct opens. Okay, common hepatopancreatic duct will open here, and this conical projection is known as the major duodenal papilla. Okay, what it means is that the point where there's an opening of those ducts, those part, the surface of the duodenum tends to be conical in shape and slightly projected. So that's why those part are called major or minor duodenal papilla. And then again you have to know that there are folds. All right, there are folds. There are many folds, which is known as the valve of the Kirk rings. And in the first part of the duodenum, the the folds are not there. So it's a smooth mucous membrane of the first part of the duodenum. So why is it important to know the location of the pancreatic duct opening? It's because to recognize the duodenal papilla, because it is often catheterized under direct vision using the duodenal endoscope, and a radio opaque material is filled in the bile and pancreatic duct. So what is trying to say is that the importance of the hepatopancreatic duct, or those major and the mainly the major duodenal papilla. It's important to know the location, because when you do one test which is known as ERCP, endoscopic retrograde cholangiopancreatography, what it does is that you'll have to find that location, and then when you find that point, you will inject the radio opaque materials, and then you can see the bile duct and the pancreatic duct. So this kind of test is used to check the bile duct and the pancreatic duct, okay, and the pancreas. So again, we are still talking about the duodenum. Now by now you know we have the first part, okay, which was in the interior, inside the interior of the first part was smooth, and we have the second part, third part, and the fourth part, right? Third part and the fourth part. Now we can see here, okay, sorry, it's first part, second part, and this part is a third part, and this part is a duodenojejunal junction, and from here jejunum starts. So from here till here is the duodenum. Now you can see this green structure. This is known as suspensory ligament of Treat. Now what it does is that it holds. It's a ligament, so it holds the duodenojejunal area, that flexure area of the duodenum, in place, fixed in place. Where does it fix? Above it is fixed to the right cruise of the diaphragm. If I don't know if you remember, when we studied diaphragm, we had the right and left cruise of the diaphragm. It is attached to the right cruise of the diaphragm, and the other end is attached to the duodenojejunal flexure. Sometimes depending on the length of this ligament, the shape of the duodenum also changes. If suppose the length of this ligament of Treat is short, that means duodenum would look more O-shaped duodenum. Okay, and if it is say if it is long, it will be more like a J-shaped duodenum. Depending on the length, also there are some the shapes of the duodenum changes. So normally it contracts. Normally the contraction of this ligament increases the angle of the duodenojejunal flexure. It's very natural. If you pull this ligament up, this angle will be more. It will increase, right? This angle, the duodenojejunal angle, will increase. And sometimes it is attached only to flexure, and then it contracts. And sometimes it can also cause partial obstruction of the gut because of the when the ligament contracts, and the orifice or the opening of the duodenum becomes more narrow. So there could be some partial obstruction of the gut in that case. Now we'll talk about the blood supply of the duodenum. We can see here, this is the aorta, okay, the abdominal aorta. From abdominal aorta, you have the celiac trunk, all right. From celiac trunk, okay, you have this hepatic artery coming out. Now from hepatic artery, you have one artery, okay, which is known as gastroduodenal artery. Okay, this gastroduodenal artery will supply the upper part of the duodenum. And again, you can see down again from this abdominal aorta, you will have a superior mesenteric artery. This superior mesenteric artery will again give rise to one artery which is known as the inferior pancreatoduodenal artery. So this arteries will supply will give blood supply to the duodenum. From the lower end, we have this, it comes from the superior mesenteric artery giving branches. From the upper end, we have the celiac trunk, hepatic artery giving branches, and then you have many different branches. You can see this anterior pancreatico-duodenal arterial arcade. Okay, arcade means nothing. Again, arcade means the anastomosis of the blood vessels. Okay, same thing here. So if you ask the blood supply, you will tell that it comes from the celiac trunk. It supplies the upper part of the duodenum. It comes again for the lower part of the duodenum. It comes from the superior mesenteric artery. Again, you have to memorize the name of the arteries. Now let's go to jejunum and ileum. We said the small intestine is divided into three parts: duodenum, jejunum, and ileum. We have done the duodenum. Duodenum is from pylorus to the duodenojejunal junction. Now from duodenojejunal junction to ileocecal junction, we'll have this jejunum and ileum. Okay, let me get back a little bit. Okay, so we have done from this part pylorus to the duodenojejunal junction. Now from duodenojejunal junction to the ileocecal junction, we'll have the jejunum, okay, and ileum. Ileum is the most terminal part. Okay, ileum is the most terminal part. Jejunum is between the duodenum and ileum. So now we'll discuss about jejunum and ileum. Okay, now the small intestine stretches from again this part. Actually this jejunum and ileum will be known as the small intestine proper. Okay, it stretches from the duodenojejunal flexure to the ileocecal junction. Now its upper 2/5 creates the jejunum. If you extend the length of the jejunum and ileum, the upper 2/5 creates the jejunum, and its lower 3/5 creates the ileum. But again, as I said, there's no clear demarcation. There's no clear demarcation between the jejunum and ileum. You just have to know that ileum is towards the terminal. It joins, it connects with the cecum of the last intestine. So we call it as a ileocecal junction. Okay. Now the jejunum and ileum are suspended. Okay, I'll come and try to explain this later. Are suspended from the posterior abdominal wall by a large fold of peritoneum known as the mesentery of the small intestine. Therefore, the small intestine appreciates a substantial freedom. So the small intestine, because it is suspended by this folds of peritoneum known as mesentery, so they have this ability to move. They are more free compared to the duodenum. So regarding this part, this peritoneum and this mesentery, I'll try to explain. I have one slide towards the end. Okay, everybody understanding? Everybody following or not?
Yes, sir.
Yes, sir.
Yes, sir.
All right then. Okay, so jejunum and ileum, nothing much to say. I'll just try to explain the the structures. Okay, structures. And I'll try to explain the peritoneum and the mesentery. What is peritoneum? What is mesentery? Okay, towards the end. You just know that duodenum is more fixed, and this jejunum and ileum, they are substantially they're more free. They can move. Okay, they can move according to their needs. So now let's see the structure of jejunum and ileum. The wall of the small intestine contains 4 layers. This is mainly something like histological. Okay, more like histology. The wall of the small intestine contains of 4 layers from inside outward, from inside to outside. We have this mucosa, submucosa, muscle layer, and serosa. Now let's see some of the characteristics. The mucosa presents the subsequent 3 important features, which are the large surface area for digestion and absorption. Now, we have said that the function of duodenum is mainly digestion, and the function of jejunum and ileum will be mainly absorption. Okay, digestion plus mainly absorption of the nutrients. The spelling mistake is the nutrients. Okay, for digestion and absorption of nutrients, the surface area of the mucous membrane is extremely increased actually by the plicae circularis, villi, and microvilli. Now, what are these? What are these plicae circularis, villi, and microvilli? See, plicae circularis, or as we already said, the valves of Kirk rings, all these are circular folds that are long lasting and they are not obliterated by distension. That means these circular folds will not go away even if you extend the jejunum, okay, jejunum or ileum. It is a permanent structure. Now villi are nothing. They are finger-like projections, okay, thrown into they are finger-like projections thrown out of the surface of the small intestine, which is the jejunum and ileum. Okay, and the microvilli, the surface epithelium covering the villi. I said villi is a finger-like projections coming out. Now microvilli are surface epithelium covering the villi, which presents the microvilli. Okay, they mainly help in increasing the surface area. Okay, surface area for digestion and absorption, mainly absorption. They increase this mucous membrane. They extremely increase the surface area with the help of this plicae circularis, villi, and microvilli, so that they can absorb properly. Now, in this mucosa, I said mucosa is the innermost layer, then you have the submucosa, then you have the muscle layer, then you have the serosa, which is the outermost layer. Okay, from inside to outside. Now, in this mucosa, you'll have this intestinal glands, which is known as crypts of Limberhunds, and also you'll have some lymphatic follicles. Okay, there are 2 types of lymphatic follicles. One is a Peyer's patch, and one is a single follicle, something like that. Okay, anyway, you'll have just remember, in the mucosa you'll have the intestinal glands, which is known as crypts of Limberhund, and you'll also have the lymphatic follicles. Now, the second layer from inside to outside. First layer was mucosa, second is submucosa. Okay, below the mucosa. It creates a loose areolar tissue and includes the blood vessels. So this layer will have the blood vessels, lymph nodes, and nerve plexus, which is known as the Macinus plexus. Okay. Then after that, you'll have the muscular layer. The muscular layer, it's created from outer longitudinal. The muscular layer will have 2 layers. One is outer longitudinal and inner circular. So mucosa, submucosa, and then muscle. The muscle layer. Muscle layer by itself has 2 layers. One is the outer longitudinal and inner circular, okay, layer of smooth muscles. And in this layer, you will have the Auerbach's plexus. Auerbach's plexus is present in the muscle layer. Macinus plexus is present in the submucosa layer. Okay, and now serosa is nothing. Again, the serosa is the visual peritoneum. Okay, it is created by the visual peritoneum. It is lined by the simple squamous epithelium. Okay, now you know what is plica circularis. Okay, these are, I just said, villi, finger-like projections, help in increasing the surface area of the small intestine so that they can absorb better. And microvilli is surface epithelium covering the microvilli. Again, increasing more surface areas. Now, points to be noted. This the overall surface area of the mucosa. So the mucosa is the surface area, is the layer where which is in contact with the food substances. Those are coming in. So the surface area of mucosa of the small intestine is about 200 meters square. Okay, and the whole epithelial lining of the small intestine is replaced every 2 to 4 days. Every 2 to 4 days, you'll have this epithelium lining replaced. So what happens in diarrhea? in diarrhea, what happens is that this lining is replaced so rapidly, okay, that it gets infected, and you'll have this the absorption won't happen properly, so that's why you have this diarrhea. Okay, in diarrhea also you have this epithelial lining destruction, and absorption won't take properly, and whatever food is coming in goes out as it is most of the time. Now this is the arterial supply of the jejunum, especially I won't say the duodenum, it's mainly the duodenum and the ileum. Okay, so here also is very simple. Looks complicated but very simple. You can see here, this is the abdominal aorta, the big one. Okay, abdominal aorta. Here you have the celiac trunk, which gave blood supply to the upper part of the duodenum, and here you have the superior mesenteric artery. I said the lower part of the duodenum gets blood supply from the superior mesenteric artery. Okay, now this jejunum and ileum will also get its blood supply from the superior mesenteric artery. There are some branches coming out from the left side of the duodenum, left side of the superior mesenteric artery, you can see. Okay, these are known as intestinal arteries, and intestinal arteries here, as they extend towards the jejunum and ileum, you can see that they are having some anastomosis. Those are called the arterial arcades. Nothing, it's all the same blood vessels, just having different formation. So this arcades, these are the anastomosis of the blood vessels. These are the arcades. Now at the end of the arcades, you see those parallel thin arteries going to the jejunum and ileum and supplying the blood. So these are known as the straight arteries. These are the straight arteries. So it's nothing. It's very simple. From superior mesenteric artery, you have on the left side of the superior mesenteric artery, you have the many branches coming out, blood vessels. Those are known as the intestinal arteries. After it comes out, as it moves towards the small intestine, you have those formation of anastomosis here. This part of the blood vessels are known as the arterial arcades, and after that, after the arterial arcades, at the end of the arterial arcades, you have the long, thin, parallel blood vessels going to jejunum and ileum. These are known as the straight arteries. This is the blood supply of the small intestine, jejunum and ileum, and duodenum we have already spoken about. Okay, now I was saying that mesentery of the small intestine, I'll try to explain to you. Before that, we'll go to this structure. Okay, this is a longitudinal section of the abdomen. Okay, now can you see my cursor? The first picture, okay, here, longitudinal section of the duodenum. Now see in the second picture, you have this blue line inside. This is the peritoneum. Now peritoneum is a layer that covers all over the abdominal cavity. Okay, this is the peritoneum. Now the third picture, you see something coming out here, bulging out, the yellow structures. These are the future organs. These are the future retroperitoneal, that is organs which are behind the peritoneum. Okay, like the liver, stomach, this colon, small intestine. This will arise from here. Okay, from the back of from the posterior wall of the abdomen, and they will push. Now come to this picture. They will push the peritoneum. They will invaginate inside the peritoneum. But then see, the peritoneum is a continuous structure. Can you all see? It's a continuous structure. All right, it's a continuous structure. Just that the structures are going inside, but they are still they are not within the peritoneum. They are still extraperitoneal. Okay, they are out. They are not inside they are not intraperitoneal. They are still extraperitoneal. They are not inside the peritoneum, though. So just imagine you have a balloon, inflated balloon. Then you push your hand inside. Your hand goes inside, but then you're not still inside the balloon. You're still technically outside the balloon, but then you're covered by the balloon all over. Can you understand, everyone?
No, sir.
No? Okay.
No,
All
sir.
right. I'll just try to explain. Okay, now see this picture. Okay, see the third picture. Here, there's some yellow stuff are here behind. Now see the blue one. Blue one is the peritoneum. Peritoneum covers the abdominal cavity from inside, everywhere. Okay, the whole. If you just imagine your own stomach, everything is covered by peritoneum. Okay. Now this yellow structures, these are the organs. Okay, organs of the abdomen. This could be liver, stomach, transverse colon, small colon, many things. Okay. So what will happen as they grow? They will push. As they grow, they will push and go inside the peritoneum. But then you can see this peritoneum is a double layered. Okay, it's a double layered. They are not destroying the peritoneal layer and going inside the peritoneum. They are still inside, but then just that part of the peritoneum is getting inside. Okay, it's not destroying the structure. It's just pushing the peritoneum inside. Okay, it's just getting covered by the double layered peritoneum. See these structures, they are going inside, but then they are not within this structure. You see this black area inside the blue line. This is inside the peritoneum, but these structures, the yellow structures, are not inside the peritoneum. Okay, they are still outside the peritoneum. It's just that they're pushing the peritoneal layer inside like this. If you can see this. Okay, wait. Okay, so anyway, now these structures goes inside. Okay, now there they have a fold. They form a fold. Now depending on the structures they are enclosing, depending on the structures this peritoneum is enclosing, the fold has its own name. So here this area, in this part, the small intestine came in, okay, like this, and this part of the folds are known as a mesentery. Similarly, for this transverse colon, this part will be known as the mesocolon. So again, for different structures, we will have a different name. Anyway, today our topic is the small intestine and small intestinal mesentery. So these are the small intestinal mesentery. Let's go to the definition. What is mesentery of the small intestine? It's a broad fan-shaped folds of peritoneum. As I said, peritoneum, okay, which suspends the small intestine from the posterior abdominal wall. It has this mesentery has a root and a free margin, like this one, like a skirt, like this skirt. See, this is the root of the peritoneum, which is in the posterior aspect of the abdomen, which is attached to the posterior abdominal wall. Okay, and this is a free margin. Okay, this is a free margin which is here, and this actually small intestine will be around here. After we cut the small intestine, we can find this small intestinal mesentery, the peritoneal fold that holds the small intestine. Okay, the root is connected to an oblique line across the posterior abdominal wall. It comes from the duodenojejunal flexure to the ileocecal junction. So it's an oblique line. So the root of the mesentery is 6 inches or 15 centimeter long, while it's free and is about 6 meter long. Okay, the root is only 15 centimeter. Okay, only 15 centimeter. Imagine your scale, the scale, 15 centimeter scale. That's it. And this one is 6 meter long. 6 meter long. Imagine a normal adult sari. That will be a 6 centimeter long. Imagine the sari and the scale. That's how you imagine this part. So the waist part or the root of the mesentery is only 15 centimeter, and the free end of the mesentery is 6 meter long. Okay, so I think you're a little confused regarding this part. Anyway, and now there are some. I think this is the last slide, or maybe last 2 slides. There's a difference. As I told you that when we look at the gross structure of the jejunum and ileum, we cannot say this part is. We can say this is jejunum because it lies towards the duodenum. We know this is ileum because it lies towards the cecum. But then, if you have to demarcate a line, you cannot. But then we can just have some characters which differentiates the jejunum from ileum. You can see that. You can see first of all the layer. The wall of the jejunum is thicker compared to the wall of the ileum. For that, you have to touch with your thumb and fingers and see. Okay, that's how you differentiate thick wall, thin wall. Now here you can see this arterial supply. The arterial arcades have just 1 or 2 rows, and whereas in the ileum part, you'll have many rows of these arterial arcades. Okay, then others too. And again, you have this peritoneum. This peritoneum is transparent around the jejunum. Around the ileum, which is towards the end of the small intestine, the jejunum are opaque. Okay, the jejunum are opaque. And the vasa recta. Okay, this is the vasa recta. I said the straight arteries, the thin straight arteries, these are called the vasa recta. These vasa rectas are short in case of ileum and long in case of the jejunum. Okay, long in case of jejunum, short in case of ileum. And again, I'll repeat this again. Peritoneal windows, or this peritoneum around this area is transparent around the jejunum, and around the ileum towards the end of the small intestine, it's opaque. It's more yellowish in color. The arterial arcades, again, the anastomosis of the arteries have just 1 or 2 layers. Okay, 1 or 2 layers of like these circles. But in the ileum, we have 4 to 5 layers, 4 to 5 rows of these arterial arcades. And one more is that this circular folds, okay, large in the jejunum, they're larger and they're closely set. They're larger and they're very closely placed. Whereas in the ileum, the circular folds, which is the interior characteristics of the ileum, the circular folds are shorter and they have less in number. And in the ileum, you'll have the Peyer's patches. In the jejunum, you have the solitary nodes. If you remember, when we talk about the structures of the small intestine, which is the jejunum and ileum, we said there are lymph follicles. There are 2 kinds of lymph follicles. I said one is the Peyer's patch and one is the solitary nodes. They are just single lymph nodes. Okay, and here we have the patches, Peyer's patch. Okay, one clinical correlation. Very common this thing, very common term actually. Merkel's diverticulum. Merkel's diverticulum is an outpoaching of the, you can see here in the diagram, outpoaching is an outpoaching or bulge in the lower part of the small intestine. Now, how do you remember this feature? There's a rule of 2's, okay, to remember this diverticulum. It occurs in 2% of population. 2% are asymptomatic. Okay, usually symptomatic before the age of 2 again. These are the rules of 2 for you to remember the Merkel diverticulum. Okay, then found 2 feet of the ileocecal valve. From the ileocecal valve, 2 feet. Okay, and 2 times more common in the male babies, and approximately 2 inches in length. The length is 2 inches in length, and 2 common types of ectopic tissues are gastric and pancreatic. Okay, this finishes my lecture. Thank you very much. If you have any doubt, I think you have doubt with the mesentery. You can have a look. Okay, go and study this part. Try to study peritoneum by itself. Okay, then you will understand the mesentery. Okay, thank you.
Thank you.
Bye, sir.
Bye bye.